osteoarthritis. This is the disease of wear and tear which appears near the old age, that is near about 40 years and above. It is due to the catabolism of the protein in the body according to the overage period, malnutrition, overwork. Moreover, if there is any traumatic injury to the joint, overweight, obesity, then there is genetic predisposition, other diseases of the bones and joints like gout, rheumatic arthritis, they also produces this ailment and the disease. So it is the disease of the elders in both the genders. Treatment is initial steps are medical one, and it is a very successful approach and treatment if it has been started earlier after the early diagnosis of the disease, which is evident from the history of the patient, from the physical examination of the health providers. Analgesics, acetaminophen, NSAID drugs, they are given in oral form. Also in severe cases, in injection form can also be given. The mostly used medicines are proxens and the diclofenac. Other group of the medicine is opioid ones. They have some side effect, but they can be initially in the start of the symptoms can relieve the pain of the patient. There is inflammation due to the superadded infection of the joint that produces redness, swollen, and the tenderness in the joints, and that can be relieved by the earlier treatment of the steroid therapy for the limited period, only for few days. Prolonged treatment is not advised because that produces thinning of the skin, discoloration of the skin, and mild other complications like cancerous form of the skin. So, steroids in the case of oral pills or in the short form, you can give to the patient. Moreover, when the patient is restless and can't tolerate the pain, then we can also inject the injection of the corticosteroid along with the xylocaine in the joint. That is called as intra-articular injection therapy. In addition to these, there is also injection of hyaluronic acid. We can also inject for the repair of the cartilages, that is platelet-rich plasma therapy is also performed. That is also infused or injected in the joint to relieve the distress and the trouble of the patient. When the medical treatment, which also comprises physiotherapy, physical exercises, and also chiropractic exercises which strengthen the surrounding tissues and the muscles and ligaments of the joints, they are also performed and they also provide relief to the patient. So it is a curable disease. Rarely, only in 10 to 15% that leads to the chronic debility or into the critical stage if neglected earlier. So Next is the surgical intervention. For that we perform arthroscopy. Then we also do the arthroplasty by the minimally invasive procedure by the keyholes operation to repair the cartilages, ligaments, and to extract the wasted material and the fluid from the joint. When the pathology is severe, then we have to perform open surgery, that is total replacement of the whole joint, especially the knee and the hip joint, which are replaced, implanted the artificial metallic joints to rehabilitate and to make the patient functional to perform his normal lifestyle to some extent. So this is called as the prosthetic surgery, that is the synthetic joints are implanted to make the person functional.